Hello, good morning. How are you? Today we are speaking of a lecture. What are intramuscular injection? My name is Begum. Welcome to my channel. Please subscribe. Okay, if you are ready, we are starting. What are intramuscular injection? An intramuscular injection is a technique used to deliver a medication deep into the muscles. This all allows the medication to be absorbed into the bloodstream quickly. What are intramuscular injections used for? Intramuscular injections are a common practice in modern medicine. They are used to deliver drugs and vaccines. Several drugs and almost all injectable vaccines are delivered this way. What are intramuscular injections used for? Intramuscular injections are used when other types of delivery methods are not recommended. These include oral, swallowed into the stomach; intravenous, injected into the vein; subcutaneous, injected into the fatty tissues just under the layer of the skin. Okay, what are intramuscular injections used for? Intramuscular injection may be used instead of intravenous injection because some drugs are irritating to veins or because a suitable vein cannot be located. Okay, do you know intramuscular injection are absorbed faster than subcutaneous injections? This is because muscle tissues has a greater blood supply than the tissues just under your skin. Muscle tissues can also hold a large volume of medications as subcutaneous tissues. Okay, and this next, and this place we have picture, and we are looking deltoid muscle. Okay, next, intramuscular injection sites. Intramuscular injections are often given in the following areas. More times, this is deltoid muscle of the arms, Vastus lateralis muscle of the thigh, and the ventrogluteal muscles of the hip, and also dorsogluteal muscle of the hip. Okay, next. Deltoid muscle of the arm. The deltoid muscle is the site most typically used for vaccines. However, this site is not common for self-injection because its small muscles must limit the volume of medications that can be injected, typically no more than 1 milliliter. And this picture, we are looking deltoid muscles, and this is deltoid injections. Okay, we are continuing. Deltoid muscle of the arms, they locate this site. Feel for the bone acromion process that's located at the top of your upper arm. The correct area to give the injection is 2 finger widths below the acromion process. At the bottom of the 2 fingers will be an upside down triangle. Give the injection in the center of the triangle. Okay, please look at this picture, and we are putting this position over hand, and we are looking, this is triangle area, and we need take injection. Okay, if we are understanding, we are continuing. Okay, next. Vastus lateralis muscle of the thigh. Okay, the tie may be used when all the sites are not available, or if you need to administer the medications on your own. Divide the upper tie into the 3 equal parts. Locate the middle of these 3 sections. The injection should go into the outer top portion of this section. Okay, please look at this picture. Okay, and we are divided 6 areas, 6 sections, and we need take injection put injection this area. Okay, this is vastus lateralis muscles of the thigh. Next, vastus lateralis muscles of the thigh. And this picture we are looking very good. Anatomy. Okay, this is sciatic nerve, femoral artery and vein, deep femoral artery, and this is vastus lateralis muscles. We need put this place injection. Okay, next, ventrogluteal muscles of the hip. The ventrogluteal muscles is the safe side for adults and children older than 7 months. It's deep and not close to any major blood vessels or nerves. This side is difficult for self-injection and may require the help of a nurse. And this is a very wonderful place. Okay. And we need to put our hand palm over greater trochanter. We need to put this position. Okay, and we are looking, this is V, and we are putting injection the central posterior iliac. We are look, this is crest and anterior superior iliac spine. Okay, this place injection side. Next, ventrogluteal muscles of the hip. Place the heel of your hand on the hip of the person receiving the injection, with your fingers pointing towards their head. Position your fingers so your thumb points towards the groin and you feel the pelvis under your pinky finger. Spread your index and the middle fingers in a pelvis under your pinky finger. Spread your index and the middle finger in a slight V shape, and then inject the needle. Oh my god, I want to sleep. Into the middle of that V. Okay, I now reading again. Spread your index and the middle fingers in a slight V shape, and inject the needle into the middle of that V. Okay. And we need to put this place. Okay, next, dorsogluteal muscles of the buttocks. The dorsogluteal muscle of the buttocks was the site most commonly selected by health care professionals for many years. However, due to the potential for injury the sciatic nerve, the ventrogluteal muscles is most often used instead. This place we have nerves, sciatic nerves. You look, this is yellow. Yeah, and this place injection site we are device for area, and we need put injection outside upper area. Okay, dorsogluteal muscles of the buttocks. This is our sciatic nerves. We need put injection to this area. Okay, what is the difference? Look at the picture. Okay, this is dorsogluteal side and the ventrogluteal side. Next, how to administer an intramuscular injection. Any person who administers intramuscular injections should receive training and education on proper injection technique. The needle size and the injection site will depend on many factors. This includes the age and size of person receiving the medications and the volume and the type of medication. Your doctor or pharmacist will give you specific guidelines about which needles and syringe are appropriate to administer your medications. The needle should be long enough to reach the muscles without penetrating the nerves and blood vessels underneath. Generally, needles should be 1 inch to 1.5 inches for an adult and will be smaller for a child. They will be 22 gauge to 25 gauge thick, noted as 22G on the packaging. First step, wash your hands with European EN 1500 standards. And also we need washing our hand antiseptic methods. Okay, second steps, gather all the needed supplies. Assemble the following supplies: needle and syringe with medication, alcohol pads, gauze, puncture resistant container to discard the used needles and syringe, typically a red or yellow plastic shrubs container, bandages. Okay, 3 steps. Locate the injection site. To isolate the muscle and target. Sorry, I want to sleep. Where you place the injection. Spread the skin at the injection site between 2 fingers. Okay, the person receiving the injection should get into the position that is comfortable, provides easy access to the location, and keeps the muscles relaxed. 4 steps. Clean the injection site. Clean the site selected for injection with an alcohol swab and allow the skin to air dry. Prepare the syringe with medication. This is 5 steps. Remove the cap if the vial or pen is multidose. Take a note about when the vial was first opened. The rubber stopper should be cleaned with an alcohol swab. Okay, we are continuing. Draw air into the syringe. Draw back the plunger to fill the syringe with air up to the dose that you will be injected. This is done because the vial is a vacuum and you need to add an equal amount of air to regulate the pressure. This also makes it easy to draw the medication into the syringe. If you forget this step, you can still get the medications out of the vial. We are continuing 5th step. Okay, after insert air into the vial and remove the cap from the needle and push the needle through the rubber stopper and the top of the vial. Inject all of the air into the vial. Be careful, do not touch the needle to keep it clean. After withdraw the medications, turn the vial and the syringe upside down. so the needle points upward and pull back on the plunger to withdraw the correct amounts of medications. Remove air bubbles. Tap the syringe to push any bubbles to the top and gently depress the plunger to push the air bubbles out. 6 steps. Self-inject with a syringe. Hold the needle like a dart and insert it into the muscle at a 90-degree angle. You should insert the needle in a quick but controlled manner. Do not push the plunger in. 7 steps. Inject the medications. Push the plunger slowly to inject the medications into the muscle. 8. Removes the needle. Withdraw the needle quickly and discard it into the puncture-resistant sharps container. Do not put the cap back on the needle. A sharps container is a red container that you can purchase at any pharmacy. It's used to collect medical waste like needles and syringes. You should not put any of these materials into the regular garbage, as needles can be hazardous to anyone who handles to the trash. 9 steps. Apply pressure to the injection site. Use a piece of gauze to apply light pressure to the injection site. You can even massage the area to help the medications. Okay, what as a complication of intramuscular injection is typically to experience some discomfort after an intramuscular injection, but certain symptoms may be a sign of a more serious complication. Call your doctor or healthcare professional right away if you experience this severe pain at the injection site, tingling or numbness, redness, swelling or warmth at the injection site, drainage at the injection site, prolonged bleeding, sign of an allergic reaction such as difficulty breathing or facial swelling. Okay, today we are completed our lecture. Bye, I love you.